Chronic respiratory conditions account for a massive health burden in India. In India, around 93 million people suffer from chronic respiratory illness. Out of this, around 37 million are asthmatics. India contributes to only 11.1% of the global asthma burden, but it accounts for over 42% of all global asthma deaths, making it, in some senses, the asthma capital of the world. Respiratory viral infections are considered as one of the causes of asthma exacerbations. For patients at risk of asthma or with existing asthma, viral respiratory tract infections can have a profound effect on the expression of the disease or loss of control. We are now in the midst of the coronavirus pandemic. What exactly is the link over here between asthma and COVID? What should asthmatics be doing in a situation like this? We're joined by the director of the All India Institute of Medical Sciences, Dr. Randeep Guleria, to look at asthma at a time of COVID. Thank you, sir, very much for joining us. Dr. Guleria, what are the general precautions that an asthmatic can take at a time of COVID?
So I think this is a taxing time for people who have chronic respiratory diseases, including asthma, and they have to be very careful. So social distancing, hand washing, and being careful about going out is something that they have to be very careful about or consider it as a very important thing. Along with that, they must continue to take their medication regularly. They should not have a fear that because of the medication they're taking, they can sort of get COVID-19 or it may aggravate an underlying COVID-19. Some patients have this false sense that if they take the inhaler and they inhaled in deeply, the infection will also go deep into their lungs. So I think proper infection control measures like hand washing, social distancing, wearing your mask, and taking your medication regularly is of paramount importance during COVID-19 for asthmatics.
Doctor, can an inhaler become infected?
An inhaler can become infected in two ways. One is if we are not careful about how we use it. Before using an inhaler, one should wash his hands properly and use it in a proper mechanism. Also keep it clean as per the instructions that are usually given with each inhaler device that is available. The other important thing is the inhaler should not be shared. There are some times people tend to share their inhalers, and I have a few patients who, a lady once told me that she was having a problem and she couldn't find an inhaler, so she just borrowed her daughter's inhaler and took it. In this era of COVID-19, that type of thing should not be done, because we know that there can be asymptomatic carriers and you can have an infection from sharing inhalers from one person to the other.
So is there actually a need for replacing current inhalers with new ones because of the presence of COVID all around us?
No, that is not really required. If your current inhaler is something that you're comfortable with and you've been taking it for some time, continue to take that until it is over. You have to be careful that if the inhaler is over, you need a new one. But you don't need to suddenly change your inhaler or currently change the inhaler that you're using and buy a new one because of COVID-19. But like I mentioned, you have to keep it clean.
Should asthmatics increase their dosage of treatment at a time like this?
So the important issue is to continue whatever you're taking. By increasing your asthma medication, there is no evidence that it will give you any added protection as far as COVID-19 is concerned. If your symptoms increase, you must definitely consult your doctor, have an asthma action plan in place. But there is really no need to prophylactically or just because of the fear of COVID-19 increase your medication. That is not required in this era of COVID-19.
Doctor, how can symptoms like shortness of breath be effectively managed, and when should one go to a hospital?
So when we look at inhalers, we have two broad categories of inhaler. One is the controller or the preventers, which control and prevent an asthma attack from coming. And the other are what we call the relievers or the rescue inhaler. So whenever you have your symptoms increasing, you can take an additional amount or additional puff of the rescue inhaler that you have been prescribed by a doctor. But if you find that the need for the rescue inhaler is going up significantly and your breathlessness is not getting under control, then it's important that you consult your physician. You could consult him by phone and take his advice as to whether you need to change your medication or start some new add-on medication for a better asthma control or for a better relief of your breathlessness.
So if an asthmatic's been coughing regularly for a few days in a row, how would they know if their condition is worsening, and when should they go to see a doctor?
So first of all, like we mentioned in the beginning, they have to be careful about the triggers, sudden exposure to change of temperature, exposure to dust, fumes. Those are the things that they have to be careful about because they can aggravate the cough. A lot of asthmatics have cough at night. It could be related to what we call gastroesophageal reflux. It could also be related to carpets in the bedroom or dust below the bed, which could cause irritation and causing cough. So you have to make sure that the triggers are not there in the environment. And like I said, you take your inhaler medication. Some people have what we call cough variant asthma, that their asthma presents more as cough, and they would get relief by taking the inhalers. But if it's not getting relief, you will need to consult your doctor, and that's an option that you should always have with you.
Should asthmatics therefore go ahead with scheduled appointments, or should they avoid going to medical centers or hospitals in the present situation? And what are your views on telemedicine in a situation like this specific to asthmatics?
So I think in this era of COVID-19, when we are very concerned that people who have chronic respiratory diseases should avoid areas where they can get an infection. If possible, try and consult your doctor through telemedicine or teleconsultation. That has now been approved by the notification by the Government of India. And therefore, as much as possible, try and talk to your doctor through phone. You could use a teleconsultation platform. On the other hand, if there is something that needs to be seen by the doctor, there is a physical checkup that is required, then schedule an appointment and be careful when you go in terms of social distancing, hand washing, and being careful about the time of the appointment. But as far as possible for asthmatics, often a lot can be done through a teleconsultation. So I would actually encourage teleconsultation in this current era of COVID-19.
What about the conditions when they just have to visit a doctor? What sort of preventive measures should people be taking?
So if you have to visit a doctor, it's better to take an appointment in advance and make sure that it's a time slot so that you don't really reach early and you're waiting in line to get to the doctor. Second is wear your mask properly, and definitely take a hand sanitizer with you and keep cleaning your hands, washing your hands. Avoid touching your face, especially your nose and mouth while you're outside, because you could touch a surface and then transmit the infection to your nose and face. And at the same time, take your rescue inhaler with you so that in case you have a problem, you can use your rescue inhaler.
And sir, if we look at nebulizers, what sort of preventive measures should be taken while using a nebulizer at home?
So the first thing to remember is that nebulizer is a device which is also an aerosol generating device. When we use a nebulizer, it also generates a lot of aerosol when a person breathes out. And therefore, in this era of COVID-19, one would actually advise not to use a nebulizer unless it's absolutely essential. So most asthmatics can manage by using a metered-dose inhaler with a spacer device and may not actually need to use a nebulizer. So first thing is to try and avoid using the nebulizer as much as possible, because it generates aerosol, and even if you feel you are all right, you may be an asymptomatic carrier or you may be in the pre-symptomatic stage, and by generating this aerosol while you're using a nebulizer, you may cause or transmit infection to the caregiver, to the healthcare workers, and to your other family members if you're doing nebulization at home. So currently avoid that. In case it's essential, you can't use an inhaler properly and you have to use a nebulizer, then you make sure that it's properly clean, the tubing and the mouthpiece or the mask is properly clean, and it's washed with soap water so that there is no residual infection in it.
How important is it to have an asthma action plan? In other words, knowing when and how to use an inhaler correctly, knowing how to monitor your symptoms at home, and adjustment in medication dosages. It's not just about visiting a doctor once, it's also about monitoring at home. So what do you tell your patients about an asthma plan to deal with the symptoms or an attack on a constant basis?
So I think this is where a lot of patient education is important. An asthma action plan is something that is going to become more important in this era of COVID-19, because this gives the patient the confidence and the ability to manage his asthma to a large extent without having to go to a doctor or consult a doctor. So he should put in a plan with the doctors should consult his patients, and they should talk to with each other and develop a plan where you look at your symptoms. You have a scoring system where you can say that if you have these symptoms, increase your inhaler by this amount, do this if this happens. So an action plan which will help in better control of asthma needs to be put in place, which includes, like you mentioned, preventive measures, proper inhaler technique, and the titration of your medication as your symptoms worsen or as they improve. So this is something which will help in a person being able to manage his asthma or control his asthma on his own and decrease the hospital visits that the individual will have to make.
Doctor, and this is perhaps something we don't in this country or anywhere talk about enough, that one of the biggest triggers of asthma attacks are anxiety, are stress. We live in times when, as a result of COVID, there are all sorts of other impacts. There's a great deal of stress on the lives of people, for whatever the reasons may be, financial, otherwise, psychological, being stuck at home. And this could potentially trigger asthma as well. So managing anxiety as a treatment to manage asthma, how important is that?
I think it's very important. Anxiety is a very important trigger which is not highlighted as it should be as far as asthma is concerned. I remember many years ago I had an asthmatic child who gave all her final exams from the emergency because she would have a panic attack before the exam day and actually land up in the casualty in the night, and then had to be treated and then go to the examination center in the morning. So it is a very important trigger that we don't really stress that much upon, and we need to put in measures to really reassure asthmatics, develop plans so that they can de-stress themselves. What we found in one of our studies is that meditation and yoga also helps, and that is something that we encourage some of our asthmatics to do, because that helps both in terms of breathing and in terms of de-stressing to some extent.
How about monitoring asthma at home? There is something known as the peak flow meter. Could you tell us a little bit about that and how this is something that patients at home need to perhaps be aware of, and if they can monitor their own sort of situation?
So a peak flow meter is a very simple device. You just have to blow into a small tube and it gives you a value. And some peak flow meters also have a color coding, that is something like red, orange and green. So if you forcefully blow out into this tube and the meter shows your reading, it also tells you whether you're in a green zone and you need not worry. If you're in an orange zone, you will need to increase your medication, and if you're in a red zone, you need to consult your doctor. So it's a simple way of monitoring yourself objectively. We use it a lot in our patients who have more moderate to severe asthma as compared to those who have intermittent or mild asthma. Patients find it useful, but again, this can be linked with the asthma action plan that we talked about. And it's a simple device which is even not very expensive, and many patients, especially the younger patients and their parents, find it useful, more reassuring that the child or the patient is doing well because his peak expiratory flow rate, the PFR, which is measured by the peak flow meter, is in the green zone, or it has a good value, and therefore the airway, there's no really significant airway narrowing and the asthma is under good control.
And doctor, how important is it to monitor these readings on a regular basis? It's not just a question of monitoring your reading once, but perhaps to have a chart over a period of time, which particularly in a time like COVID now can be presented to a doctor to prevent visiting a doctor if it's not required.
Correct. So it's important to see the trend. There's also important to see the diurnal or day-to-day fluctuation that happens. There are some asthmatics who have a lot of fluctuation in the peak flow meter or peak flow rate, and that also is an indication that the asthma control is not good. So looking at the diurnal variation of your peak flow rate and also seeing the trend. So if there's a trend that your peak flow rate is actually coming down over a period of time, that is also an indicator that your asthma control is becoming poor, And that's why a chart or a diary can also be maintained, recording your values on a daily basis.
And doctor, if we talk about COVID, in the last couple of months, when there has been somebody who goes to a hospital with a predisposed condition of asthma or some sort of respiratory ailment, how much more destructive is COVID?
So when we look at chronic respiratory illnesses, COVID is a risk factor as far as causing more chronic respiratory diseases are a risk factor as far as chronic causing more severe COVID infection is concerned, and especially in those people who tend to smoke also, it becomes another risk factor as far as smoking is concerned, because it sort of causes an impairment in your lung defense mechanisms. Therefore, COVID is a risk factor and we need to be careful. On the other hand, asthma per se, whatever data that has emerged, has not come out to be a very strong uh, factor in terms of causing very severe COVID infection. However, it's still early days because the number of asthmatics documented have not been that large. But I think we need to keep in mind that this is a chronic respiratory disease, and therefore patients have to be extra careful regarding exposure to COVID-19.
One final question to you, again, in terms of medically examining COVID patients. Uh, the lungs become very badly impacted initially, and you spoke about respiratory ailments being a constant problem. In terms of progression of the illness among those who perhaps come in with weaker lungs, is it possible to statistically tell us how much faster it progresses?
So in those individuals who have chronic respiratory disease and who have impaired lung defense mechanisms, or who have lungs which are already, let's say, compromised because of various chronic diseases, there is a much higher chance of the viral infections like COVID-19, which are predominantly in the upper airways, going down into the lower airways, and if that happens, then elimination of these viral infections from the lower airways, or the clearing of these viral infections from the lower airways, is more difficult, and it leads to a more widespread infection, a more severe infection. This can happen within 1 or 2 days, and this can be associated with higher mortality because these individuals then have a fall in their oxygen saturation and therefore need to be either on a ventilator or need high flow oxygen, which thereby increases the chance of more complications and makes the COVID-19 infection more severe.
Doctor, in a few days from now, and what we've seen over the last 1 week or so, 1 week plus, a gradual opening up of the economy, more people out, 33% workforce out over there. And therefore, in the next few weeks, when we can assume that there will be more industrial activity, pollution levels in the air will certainly go up. And so then we'll get into the winter months in a few months from now, when pollution is going to be a problem. COVID isn't going to be sorted out by then. And then you have the entire issue of asthmatics, who as it is suffer during winter months particularly. So COVID, asthmatics and air pollution, which we don't have now. This is the best air we've probably had in our lifetimes. How is that going to be a potential problem, let's say, in winter onwards, if the economy does open up?
Yes, so as we have seen over the last few winters, the pollution levels have been very high. AQI in major cities, and especially in the Indo-Gangetic plain, has been very bad, and this has really affected individuals with chronic respiratory diseases, including asthma. And therefore, it's my worry that people are not in asthmatics or those with chronic respiratory disease are going to have a bad time. Not only are they going to have the consequences of high levels of air pollution, but the risk of COVID-19 will also be there, and therefore we need to really develop strategies of good asthma control and see how we can protect the vulnerable individuals, especially those with chronic respiratory diseases.
Doctor, we've been talking about COVID non-stop for so many weeks now, but in the last few weeks, when we've had this fantastic air quality around us, has there been a reduction in inquiries or cases associated with asthma or general breathing distress unrelated to COVID?
Yes, I think so. There has been a decrease in the number of people who have had acute respiratory problems, which could have been linked to air pollution itself. Documenting how much of it is because of good quality air is going to be difficult, because there has also been a lockdown, and therefore some people have not been able to come, even if they wanted to, because of the lockdown. And the argument has been that maybe the lesser numbers are related to the lockdown rather than the air quality. But I would say that I'm pretty sure that, and this is basically by talking to patients, that they find that the breathing is much more comfortable nowadays than it had ever been during these months in the past. So I think it has made a big difference.
All right, Dr. Guleria, thank you so much for speaking to us and urging asthmatics to be careful, always, of course, and in a situation like this, COVID-19, the additional steps that need to be taken. Thank you very much indeed.
Thank you.